I'm Gabby Scott. I'm the clinical nurse educator here. Most of you probably know me. I've been going around and doing PPE education, donning and doffing, kind of review with everybody, and then throwing in that hand hygiene aspect as well. It's good for us to always review, and now especially with the COVID-19, there's just one kind of small recommendation that is with our donning and doffing that I'll talk about. So please utilize this video. I know a lot of staff I've met with, I have yet to meet with. People are asking me, can I go up and meet with them? So please reach out to me with any questions, and Sharon Martin is our great resource as well. So keeping in mind that we should be fit tested, and if it's in your job description, if you have any questions about what size you are, most of us have the stickers on the back of our badge that tell us the size of our N95s. That's going to be for airborne if we are doing nebulizer treatments or intubations for COVID-19 patients. Otherwise, it is now considered a droplet precaution. So if you're going to be that provider in the room doing an aerosol treatment, or like I said, during intubations, make sure you know what size mask you are, and that you know that you have some available for yourself to use for that. But otherwise, we're just going to stick with our surgical masks and consider droplet precautions. So hand hygiene. They're really recommending soap and water for COVID-19. Alcohol-based hand sanitizer is effective, but really they're recommending and encouraging soap and water. We do have a shortage with the hand sanitizer, so we have lots of soap and water, so try to stick to that as much as we can. And as far as the isolation attire, we're going to talk about donning and doffing. So when you don, you're going to do your gown, mask, goggles, and gloves. When you doff, and here's where the change comes, you're going to do gloves and then sanitize. So they want you to actually take a squirt of sanitizer before you finish doffing. Goggles, gown, and mask. So I'm just going to demonstrate how to put our attire on. So we're going to don. So people ask me, does it really matter the order? Everything's clean at this point, so not completely, but then again, yes it does, because if you watch in sequence, you're going to realize these steps have to happen in order for you to get your attire on the proper way. So yes, the order does matter, but yes, everything is clean at this point. So we put our gown on. Now these ties can be tricky. If you are unable to tie your own ties, you can have a buddy assist you in your ties of the back. So I tie my top, I tie my bottom, make sure I'm protected all the way around. Next is my mask. We have a white side and a colored side. Colored goes out, so this is the ear loop. It's a little bit easier than the surgical ties. If I were to have the surgical ties, I would want one above my ears and one on my neck, but with the ear loop it's a little bit easier. So you just pinch around the bridge of the nose, you want that seal. Make sure your mask is on good. Now I have my mask on, so what's going to go on next is my goggles, eye protection. So if you are that group that has a face shield, then you would put that on at this point. Goggles. Lastly, my gloves. So my gown is impermeable, the yellow part, just not the cuffs. So you'd want to cover those cuffs up with your gloves. So I always pull my sleeve down and then pull my glove up right around that. So I am fully in my PPE. Okay, so now I've done my tasks, taking care of my patient, I need to doff. So we're going to start with our gloves. Keep in mind that they are dirty, so we don't want to touch anything. So that kind of helps just with the order. Again, if it's in alphabetical order, so gloves, goggles, gown, and mask, GL, GOG, GOW, and then mask is last. And that's very important. It's all very important, but that's your respiratory protection. So that's going to be last. So gloves, you want to take it from the inside. You don't want to touch yourself with it. Same thing here, you wanna go underneath and curl, and you don't wanna throw any of this stuff because it's all contaminated. So we dispose of our gloves. Now is the COVID recommendation. A squirt of hand sanitizer. Hands are sanitized. I'm going to take my goggles off from the back part. I'm not going to handle them from the front because that could be the most contaminated part. Goggles. Next is my gown because I want to keep my respiratory protection on until last. I start at the top and I keep my arms away from my head because my sleeves are dirty. I handle the insides of my cuffs like so. I keep my gown away. I don't shake it. I roll it up. I put it in my soiled utility. Now my mask is last. Again, consider the front of this contaminated. So start at the back and dispose of it. And now I go wash my hands with soap and water. And that's it. So if you have any questions, get a hold of me. And there's going to be an attachment. I know a lot of you have asked for the PPE donning and doffing flyer, so we are going to put that out. I'm going to be bringing it around to the departments, and there'll be a copy of it online for you to print. So, thank you.